News Channel 7. This is Viewpoint.
Good morning. You are watching Viewpoint here on KTVB. I'm Joe Paris. It is the beginning of a new chapter for Idaho's largest state agency, one that encompasses major state programs and budgets, the Department of Health and Welfare. Back in May, Governor Brad Little announced that Alex Adams would be the new director of the Idaho Department of Health and Welfare. Adams previously served as the administrator of the Division of Financial Management, DFM. He did that since 2019. And he steps into an agency that has been in the headlines in recent years, major challenges that need solving. The interim director, Dean Cameron, stepped in for a while, and he was applauded for his work by the governor's office. But the full-time gig now belongs to our guest this week, Alex Adams. And Alex, thank you so much for being here. I know you've been on a media tour since you've really taken over the job. We have a lot of topics to get into, but I think just for starters, when you start this job, what was the biggest, goal or your biggest topic that you wanted to tackle right out of the gate?
Yeah, well, I think the first thing to know is this is a large agency, 3,000 folks, 40 agencies across the state. It runs hospitals, it runs intermediate care facilities, it runs everything from food stamps and child support to regulating public swimming pools. So an organization of this size, the more you try to do, the less you'll accomplish. And conversely, the more you sharpen your focus, the more you can achieve. And where I've set my compass is we want to make a real difference for child welfare, improving child welfare outcomes, improving the foster care system, and making a difference for the children. I see that as where we can make the largest return on investment for Idaho for generations to come. And
that's something we've heard about from Idahoans for years, and we will jump into that in a little bit. Something, though, I just wanted to circle back to quickly, and this is something that you kind of step into yourself. A major story we followed, questions about $72 million for grants that would be for school-age kids in programs. This was a COVID-era ARPA-type funding. A legislative audit showed last year that money maybe wasn't used appropriately. There was an AG's investigation, and it kind of connected with the belief that there was reckless or inappropriate spending with taxpayer dollars, federal and local. Do you believe that the interim director, Dean Cameron, was able to kind of set up a path forward in terms of his plan that he presented to lawmakers when he said, hey, we have to make some fixes, here are some steps?
Yeah, Director Cameron did do a corrective action plan that he presented to the legislature. That plan did seem to be well received by members of the Joint Finance and Appropriation Committee. That is the committee that has oversight for the appropriate use of funds. And it did commit the department to doing many things, improving internal controls, improving internal training and things like that. And we've been working through those and ensuring that corrective action plan is fulfilled. I think the broader issue, it does speak to a lot of the issues that have surrounded the department for years, which is trust and accountability. I think prior to the pandemic, departments of health, serviced a lot of Idahoans, but they were kind of those back-end agencies. They just got things done. They processed applications. I think what we saw with health departments across the country was during the pandemic, it did catapult departments of health into being frontline players. In many instances, the directors in some states were doing daily briefings or daily media events with their governors, and fortunately or unfortunately became household names in many instances. Yeah. So with that, I think it's brought a new level of scrutiny to departments of health. It's brought a new level of accountability, and a lot of my message to the staff has been we have to be welcoming that. We have to be comfortable with that. We are the largest agency. The largest budget expense in Idaho is no longer education. If you look at total funds, health and welfare is the largest budgeted program in the state. That deserves public scrutiny, and we need to welcome that and be more transparent and be more accountable. So a couple of the things I focused on early is improving transparency reports. Starting next month, we're going to publish a monthly report on Medicaid forecasted expenditures to actual expenditures. And next month, we're also going to start reports for each of the welfare programs, census, dollar amounts that went out, fraud investigations, and things like that, just so that there's a little bit more confidence in what we're doing. The program you referred to specifically related to daycare grants. I have made daycare one of the early priorities as part of my broader child welfare goals, and took some actions, including today, to the extent you want to talk about any of those.
Oh, yeah. Well, tell me, I mean, I got to be honest, we told the viewers that I'm having a child at the end of the year. And my wife and I, we've started looking into daycare options. And I was curious, if you look across different parts of Idaho, there are much different, I guess, scenes. In terms of fixing or addressing daycare options, I guess, what actions have you taken?
Yeah, so, I guess first, what is the role of the department with daycare? So we run the Idaho Child Care Program, which does provide subsidies to help Idahoans in need access daycare, just given the cost. I mean, and for many Idahoans, it's out of reach, and people have to wrestle with that decision of leaving either the workforce or paying something that is out of reach to them. So we do have subsidy programs. We license daycares to ensure safety, and other related programs like that. So a couple things that I did, we do have a daycare desert throughout Idaho. We have generally more need than there is access, and we have waiting lists and high costs. So I've taken a couple actions. Last week, I waived the fees for small daycare providers. So if you have a family home where you're inviting children into the home as a daycare center. We used to have a fee for these facilities that service 6 or fewer children. I waived that so that cost was not a barrier to entry into setting up a new daycare. The other thing we did, and I signed this today, it will expand access. We have a ratio of students per teachers. I did not change it for infants, but for the non-infant group, I added 1 student to the ratio. Other states have more lax ratios than us, so that lived experience demonstrated that's proven safe in other states. We did a comprehensive literature review to make sure that it would be safe and effective to be able to do so, and enough evidence was presented to me that I felt confident. So what does expanding that ratio mean? If every daycare in the state of Idaho added 1 seat to the non-infant group, it would add 600 to 700 seats statewide with a stroke of a pen. That might come as relief to many parents, but certainly parents have to weigh cost and quality. One of the things that was important to me with my daughter was, high quality daycare and infusing some of those early learning principles. So, it gives daycares the ability to add 1. It gives parents the ability to look at whether or not it makes them. But if everybody avails themselves to that, the action today would add 600 to 700 seats statewide.
And when I've kind of dove into the daycare world recently, you find one of the things that you'll hear from people is, this is your largest investment in terms of your child. This is the most important thing in your life. Of course, we want to make sure that things are going well. At the same time, though, as you highlighted, I mean, there's these challenges of parents having to leave the workforce, or, trying to make sure they leave the child with someone they trust. It's a lot to handle, and it is comforting as a future parent to know that the state is looking at this stuff after we've heard, the desert complaints.
Yeah. And, ensuring accessibility was one of the things that was critical to me. Preserving the department's role of ensuring safety was critical to me, and I think this struck the appropriate balance. We are also going to look at how we can maximize some of our state funds and some of the federal funds that we get in to maximize the amount of subsidy that's available to Idahoans that are in need for daycare.
Another major topic we just touched on a second ago, Medicaid. I know that that's been something that, as part of the governor's office, I would imagine you've seen a lot of numbers crunched. There's been some lawmakers that have criticized Idaho's Medicaid program for ballooning or just becoming too much of a burden. As I think the largest state program that you oversee, what are your impressions when you walk in the door, and what fixes do you think need to be made?
Yeah, so we are the largest state budgeted program, as I talked about. We've overtaken education, for better or worse, as that, and that was post-Medicaid expansion. And, I think the most important thing for folks to know is that the biggest driver of Medicaid budget growth is what the state classifies as non-discretionary growth. And in many ways, we're victims of our own success. Medicaid is a complex partnership between the state and federal government. And the feds will reimburse a portion of every dollar spent on medical expenses for qualified Medicaid patients. The percentage that they reimburse, though, is linked to your state's per capita income, meaning the richer the state, the less they'll reimburse. And conversely, the poorer the state, the more they'll reimburse. Under Governor Little, we've seen personal income growth faster than perhaps any other state in the country. There were some years we were #1 in personal income growth. I think we're still, top 3, if not top 2. And as your personal income grows relative to other states, your Medicaid match rate from the feds go down, and then the state taxpayers have to make up that difference. So we're going through our budget exercises for the budget that we're going to submit September 1. And because of personal income growth in Idaho relative to the rest of the country, that adds about $70 million to the state's budget this upcoming year. As a former state budget director, that's not an ideal situation for me to have to carry into the next legislative session. So I think a lot of it's going to be messaging around why is it growing? What levers does the state have to pull, and what levers does the state not have to pull? I can't change our personal income numbers, and I don't think we want to. I don't think any Idahoan wants to change the personal income growth that we have. But you are going to see us put forth, kind of a menu of options for the legislature. If they don't want to cover that, what are some of the levers they could pull, and what would be the pain associated with pulling those levers? But, a lot of what I've asked my team to do is, let's kind of take a pause on Medicaid. I don't want to come in with requests for new, expansions or provider rates and things like that, because I want my focus to be child welfare. I do think, it's kind of gotten crowded out by other priorities post-Medicaid expansion, and I want to do things that will invest in more caseworkers, that they have the time to work with foster families the way that social workers were trained. I want to improve the rates that we pay to foster families, particularly for therapeutic care and things like that. So a lot of my approach has been, how can we, minimize the growth in Medicaid for the purposes of putting our dollars where I do think we will get the largest return on investment for Idahoans. That's not to say the Venn diagram doesn't overlap.
Right.
One of the things that's most needed, frankly, for those in the child welfare system is access to substance use disorder treatment, access to mental health and behavioral health care services. So I do think that they are connected to a point, but to the extent that they diverge, my priority is going to be child welfare.
And as you highlighted, if you do everything, you're doing nothing. So it's interesting to see, how specific of a lens you can get into. We do have to take a real quick break, but you are tuned into KTVB's Viewpoint. Our guest this week, Alex Adams from the Department of Health and Welfare. When we get back, we want to talk about foster care in Idaho. Director Adams has already taken major steps to improve it here in the Gem State. We'll be right back after a quick break.
This is what Molly's family doesn't call the media room. So this is how Molly deals with random clutter, tacky remotes, ugly wires. This is designed by California Closets, a company that's been listening to customers like Molly for nearly 50 years. Schedule your free design consultation now.
Bowman Funeral was started as a vision by a family to help families. Throughout the years, that vision has stayed the same. We offer high-quality services and arrangements in a family atmosphere, from a family to your family.
We've been here since 2004 with a goal in mind to offer families informed financial decisions and help them make an informed financial decision.
We invite you to stop by, call us, or visit us online.
We are Bowman Funeral.
Lowe's knows the right paint at a great price can get you the right look today. That's why select paints and stains are buy two, get one free, so you can refresh your space inside and out. Paint more for less this July 4th.
With Life Alert, one touch of a button can get you help fast.
I've fallen and I can't get up.
Don't worry, help is on the way.
With any of Life Alert's 3 emergency systems, help can be summoned immediately, and batteries never need charging.
I was having a stroke, and I was scared to death.
If it weren't for Life Alert, I wouldn't be sitting here today. Life Alert is a lifesaver.
My husband is alive because of Life Alert.
Life Alert is the lifesaver to keep me out of assisted living.
Life Alert saves a life every 11 minutes.
For a free Life Alert brochure, call 1-800-710-1914. That's 1-800-710-1914. Call now, 1-800-710-1914.
Hey, welcome back to KTVB Viewpoint. I want to jump right into our conversation, continuing with the Department of Health and Welfare Director, Alex Adams. Alex, something I noticed, within days or maybe weeks of you jumping into this new role, foster care. That was something that seemed to be at the real tip of the spear for you. Is there something about foster care that you were so passionate about, or did you just see holes that needed to be filled?
I would say, I worked for 5.5 years in the budget shop. This was a constant recurring theme. Legislative oversight committees on child welfare, Office of Performance Evaluation, report after report on opportunities for improvement in foster care. I came in and I said, let's tackle that. Let's roll up our sleeves and let's see if we can make a difference. And I didn't want to wait. I grew up in a small town called Defiance, Ohio, which my wife tells me is very fitting, and patience was never my strong suit. So I said, I want to hit the ground running. And as I started to prepare for this job, I met with foster families throughout the state, by phone, in their homes, over coffee. I talked to some of the legislators who have been in this fight for years and started putting together a list of ideas and came up with some that I thought I could act on quickly. So on day one, minute one, I waived adoption fees through the department. If you're going to adopt a child out of the state's foster care system, I didn't want cost of home studies, of application fees to be the barrier. If you're willing to open your heart and open your home to one of these childs, I didn't want to be the barrier. I want to facilitate that. I do want us to increase the number of adoptions in Idaho, and I do want to speed time to permanency of those placements. The other things I did, we redefined kin to include foster families. Foster families are often the most significant relationship that the child has in their lives. If you've been with them for 6 or more months, we now included them in the definition of kin so that they had that status in Idaho. And then we simplified the licensure of foster families. If you apply, we used to have a rule that said the department could initiate action within 30 days. I changed it to 1 day. The only reason I changed it to 1 day is I didn't think I could get away with 30 seconds, which I thought it should have been. If somebody is willing to open their door and make a difference in the lives of these children, we're going to welcome them. We're going to give them concierge service. We're going to do everything we could to get through that. Simplifying licensure, there's quite a few things, but maybe one to just highlight is, we want these kids to be in safe and stable environments. We have a lot of safety and fire restrictions, things that, make, good sense and they're hard to argue with. But, for safety reasons, we want every home to have a carbon monoxide detector near the room. We want every house to have a fire extinguisher. I don't even know if I have a fire extinguisher, to be perfectly honest. So what we said is, if we show up and we do an inspection and we're going through the licensing process, if it's an otherwise qualified family and one that would be a great addition to our foster family, if they have a technical barrier, they don't have a 4-foot fence around their hot tub, if they don't have the fire extinguisher, if they don't have one of these technical requirements, we're going to buy it for them for the purposes of getting them licensed and into the foster system. So we moved on those things quickly. I will be absolutely crystal clear. Not one of those is going to address or solve the problem that we have. What they're going to do is nudge us in the right direction. But a lot of what is needed is culture change. And culture takes time, but culture is the most important thing you can do. So we're also working on a foster family bill of rights. We put out a draft. The goal is for it to take effect on August 1st. That gives us time to train our caseworkers and our staff all throughout the organization on what our expectations are for timely communication, creating a safe and welcoming environment, involving foster parents in the decision-making process of the children that are in their care, and that culture change is going to take time. I am shaking up personnel a bit. I brought in some outside entities to help us with those. 2 I'll name. Reorganize the department into a new wing that oversees all children's, youth, and family services. Monty Pro is going to be my deputy director overseeing those. Some of your viewers might remember Monty. He used to be the cabinet level director under Governor Little for juvenile corrections. Monty was seen as just one of those good government. He's got a big heart. He invests in prevention. In fact, his goal at the Department of Juvenile Corrections was to be so effective that there no longer needed to be a Department of Juvenile Corrections. I needed people like that with that mindset around me. Working under Monty, the division administrator for what's going to be called Youth Safety and Permanency, overseeing foster care and adoption and child protection is going to be Jean Fisher. No stranger to your viewers. They've probably seen Jean Fisher on Channel 7 before, because she used to be the deputy prosecutor for Ada County. She served there for 30 years. And anyone that's been on the other side of the courtroom as Jean knows she's an absolute bulldog. She will fight like hell for these children and to ensure that the best interest of the children are placed first. And I needed people like that as part of this.
And I know that Jean's one of those people that you're going to send her off and she's going to go after it. And she's someone that, to be frank, she doesn't have to do this. This is something that she could be retired and move on. But as you mentioned with Monty, with Jean, these are people that want to make a difference in Idaho. As the director, I would imagine that's pretty inspiring.
Yeah, I wanted people like that around me. And I said in many ways I assembled what I would put person by person against the 1992 Olympic Dream Team. This is the Dream Team. We have people who have a track record of getting things done, and I want people like that fighting on my side. Jean hasn't even started, and she's already working on a couple rule drafts that we're going to put out there and try to move in the weeks or months ahead. One relates to transparency. Right now, the department has a policy around minimum transparency as it relates to foster care and child welfare, and we want to change that to maximum transparency for the interested parties in the case. To the extent it will improve children's outcomes and lead to better outcomes, we're going to switch to maximum transparency for those interested parties. She's also working on some regulations around visitation with the biological parents, and putting some, frankly, safeguards around visitation. And at risk of breaking news, I don't know that child abusers or sex abusers are going to like the draft, but we think it is in the best interest of the children. And where there's a fork in the road and the interests diverge between the child and the biological parents, our North Star is going to be the best interest of the child.
In terms of some more specifics, there were some major ideas to address, the foster care system. And I'm curious, the Idaho Department of Health and Welfare had a plan on renovating a wing of the Lewiston Juvenile Corrections Center that would be made for foster cares. Is that something that you're still looking to do?
It is. So, a lot of our philosophy is right kid, right place, right time. For most kids, the most appropriate setting is a home setting, a foster home that replicates a traditional child's upbringing, where there's a parent or parents in the house. They're eating as a family and replicating normal life. However, some behaviors are so complex that they're not well served in a family home, and congregate care settings are needed. They should not be the default, and the legislature passed new policies to get the number of foster kids in congregate settings down and pushed back into traditional home settings. So, you're probably seeing the disconnect between building a new congregate care facility in Lewiston while there's a push to get kids out of congregate care. But, one thing I would just highlight, historically, about 5% in round numbers of the kids in foster care have been in congregate settings. Right now, in round numbers, it's about 20%. And that is straining our budget. I inherited a $24.8 million budget deficit, which again comes with a huge dose of humility to a former state budget director who now has to walk hat in hand into JFAC and explain, here's what happened, here's what we're doing to fix it. But such will be my life come January. But congregate care is necessary for a subset of the population that has highly complex behavioral health challenges, aggressive behaviors, or others where it's not appropriate to put them in a home setting. With that, the closer they are to home, generally the better the prospects of keeping family connections and promoting reunification. So the department recently opened one of these facilities in Payette, but having one in Lewiston will help service North Idaho children, North Idaho families, and promote reunification where that is appropriate.
We are short for time, so I just have time for one last question for you. I know that it was major news, and Idaho politicos were excited, and the ones I spoke to when you took this job. Did you find that you were uniquely positioned after working in Governor Little's administration, especially leading DFM, to step into this world, which I don't think it's any secret, this was a tough job to step into. This is not an easy task ahead for you.
That's frankly what appealed to me, was the challenge that it presented. And I would like to think that I have the right person for the job. I have a track record of getting things done in state government, cutting through red tape, getting things funded, working with a legislature, working with this administration, and working with a stakeholder community. So I wouldn't have left the comforts of the budget shop if I didn't feel like I couldn't make a difference here. This felt like the right move for me at the right time. My background is healthcare as a pharmacist by training, so in many ways this is back to the future for me, and look forward to working with all stakeholders, including many of your viewers, and making a meaningful difference.
Well, there's a reason that they call folks like you public servants. A lot of good work to be done. Alex Adams, the Director of the Department of Health and Welfare, thanks for joining us here on Viewpoint. We'll have to have you back soon because I had a whole list of questions to get into. I don't think we got into them all, but appreciate your time as always, and thanks for stopping by.
Thank you.
All right, we will wrap up this program right after this break.
We have some bad news and some good news about taxes today. Here to talk about it is Tyson Thacker of Boss Retirement Solutions, a 5-time winner of the Best of State Award. Tyson, what's up with taxes?
Nisha, first, the good news. And here it is. Tax rates are the lowest they've been in over 40 years. The bad news, taxes are likely to go up in the near future. And if you're not prepared for it, the retirement you've been working so hard for could be just out of reach, because your IRA, your 401k, your Social Security, all of these retirement income sources, they're taxable, which means you might have a lot less to spend than you think you do. But there's a smart money move that could change all of that by converting these pre-tax dollars into tax-free dollars. How? By converting your traditional IRA or 401k into a Roth.
All right, Tyson, how does this work, and how do our viewers know if this Roth account is right for them?
Nisha, we can show you how with a free customized Roth conversion analysis. Here's how it works. We get some basic information from you, and one of our fiduciary advisors runs the numbers. They're going to show you exactly how much money you could save by converting to a Roth. Now, so many advisors are charging hundreds of dollars for a customized tax analysis. But here's the best part. We won't charge you a dime for this service.
Good to know. Thank you, Tyson. To learn how much you could save in taxes when you retire, call the number on your screen right now for a free customized Roth conversion analysis. If you've saved at least $200,000, just call the number on your screen to schedule that free analysis. There's no cost or obligation, but you must call today to get on their calendar. It is from Boss Retirement Solutions. They've helped thousands of families save on taxes when they retire, and they could help you too.
Hey, welcome back to KTVB Viewpoint. We again thank our guest, the Director of Health and Welfare, Alex Adams, for joining us here on Viewpoint. I'll just say on a personal note, as an Idahoan, it is extremely comforting to see somebody in such a high priority spot have the passion and the willingness to dive into a department that deals with so many long-ranging and wide-ranging topics here in the state of Idaho. So, Director Adams, we appreciate you stopping by, and we're excited to see what work you do at the Department of Health and Welfare. Also of note, this past week, by the way, a major opinion from the United States Supreme Court. Basically, they say, we're going to push this EMTALA question, the interaction between federal EMTALA and the state of Idaho's abortion laws. They're going to push it down to the previous court. So we will be diving into this on a future episode of Viewpoint. But if you wanted to catch up on all of our coverage with the Idaho abortion laws and the United States Supreme Court, head to our website right now at ktvb.com. You can also check out the special 3-part series that the 208 team did just last week. Again, you're watching KTVB Viewpoint. I appreciate your time here on a Sunday morning. We will step aside for now, but we will see you next time here on Viewpoint.